Welcome into Factfinder Investigates. I'm Dylan Domingue. A family's fight to get their mother, Christina Novak, the medication they say she desperately needs after being diagnosed with hyponatremia last year. They called Factfinder 12 after insurance denied her medicine that had previously been approved and has since left them paying out of pocket in the meantime.
Helpless is not even an appropriate word to describe how I feel, especially as a nurse.
Krista Gann is used to helping her own patients working in the medical field, but recently her work has been closer to home, having to take care of her mother.
We have all of this that shows she needs it.
It's among this pile of paperwork, from hospital visit summaries to medical records, that Krista says is proof her mom, Christina, needs specific medication to keep her healthy and out of the emergency room.
She couldn't even go one day without some sort of medical intervention.
That medication, Tolvaptan, originally prescribed by doctors and approved by Christina's insurance, Blue Cross Blue Shield, in August of last year. For a year, Christina took Tolvaptan, and her family says her life went back to how it was before. That was until her prescription ran out, and she tried to get more.
Yeah, when we went to go renew that prescription in August of this year, they said no.
Needing the medicine, Christina filed an appeal. This response from Blue Cross Blue Shield shows the insurance company told her the denial for Tolvaptan was being upheld, calling it a medical necessity benefits decision and saying the denial is based on medical documentation and does not support long-term use of Tolvaptan.
Yeah, it's been proven time and time again that she needs this.
Christina continued to appeal, but while waiting for an answer and not having her medicine, she ended up back in the hospital, sick. Her daughter, Krista, says it was the one place they could go to receive Tolvaptan.
You're essentially bringing your mom to the hospital, admitting her to the ER, just so she can get that medication right now.
Yeah.
That led to Christina's doctors reaching out to her insurance, asking them to reconsider their decision. In this letter, her doctor wrote to Blue Cross Blue Shield. He called the denial frustrating and time-consuming, despite repeated efforts from their office to get the medicine approved, including a peer-to-peer review with the insurance company. That letter was sent last month. To date, Christina and her family still waiting on answers and an approval.
And trust me, insurance company, I don't want her life to depend on this medication any more than you clearly do not want her life to depend on this medication.
In the meantime, the family is paying out of pocket and having to travel out of state to pick up her medicine. A 30-day supply of Tolvaptan recently cost them $1,900.
If you would like to donate and help us with that, the link is in my bio.
Christina's family is using social media to help raise the money. Her daughter, Kinsey, shared their story to her 1 million followers on TikTok. And while they say they are thankful for the support they've received, it's not a long-term solution as they wait and hope for insurance to approve the medicine.
The clock's ticking to the next when her medication runs out.
And right before this airing, we heard from the family that their insurance responded to the doctor's letter saying the medication would still be denied. Now, we did reach out to her insurance company to ask what the next steps Christina should be taking in her case, but have yet to hear back. After more than 4 months, the search for David Reese came to an end this week. Following the discovery of his truck, a K-9 team found his remains on Monday. Factfinder investigator Sean Logging speaking with officials and friends on the end of this search.
Last heard from on August 2nd, the long search for David Reese has concluded. The 4-month-long search ended in a rural part of Barber County between Medicine Lodge and Hartner. The ranch owner showing us the location he was found.
It was unfortunate how it ended, but I'm glad we got some closure for the family.
Tuesday, Barber County Sheriff Jason LeClaire confirming remains were found about 100 yards from where the truck was found Sunday after a search by a K-9 team and assistance from the KBI. It was in an area the search has focused on for months, after Reese was last seen driving in the area by a ranch owner on August 2nd. That included people taking their own planes up to search the area.
We had over a 600-mile area we were trying to find the needle in a haystack, and we didn't know where the haystack was at yet. When we got the dog finally find up, we kind of narrowed that search to about 10 to 15, 20-mile area. And even then, we got, lots of canyons, lots of creek beds. The coverage was pretty rough. I believe the foliage falling off the trees is the only reason that this vehicle was discovered at this time.
This creek bed is where Reese's truck was found Sunday afternoon by a worker on a nearby farm. It's also not far from where his dog was found nearly a month ago.
It looked like he got lost in some pastures. He had opened some gates, gone through some fences, and where he ended up getting stuck at, he probably was completely disoriented, didn't know where he was at.
Sheriff LeClaire says the remains were identified through a serial number from a hip replacement. He says that no foul play is suspected. For Reese's friends, while it's not the ending they were wanting, it's an end to the mystery of not knowing where he was and what happened to him.
Through this, we located his dog, which was a great piece to be able to provide back to the family. And then now here we are another month later, we're able to provide them with their loved one and kind of bring a little bit of closure to the situation.
And after Reese's dog was found last month, it was reunited with his family. We do have an update to a Factfinder story this week that has many of you asking how you can help out. We told you about Shauna Purdue, a Wichita woman who recently lost thousands of dollars in an Apple security scam. We first want to show you the scam and how you can protect yourself. Shauna says she received a text telling her that her Apple ID had been used to spend over $140. The message said the purchase looked suspicious, and if it wasn't done by her, to call a specific number. Shauna called, and the man on the other end told her hackers were attempting to break into her account, and what she needed to do was move the money around in her bank account. The caller had her load her Venmo card with money and also go to Home Depot stores and spend $3,500 on gift cards. She thought the man was helping her protect her account from hackers until she realized that thousands of dollars had been taken from her.
I just feel so stupid, so foolish, so taken in, so violated, actually.
Shauna did file a report with the Federal Trade Commission and Wichita Police. Her bank told her because she authorized the purchases that she would not be able to get the thousands of dollars that she lost back. Now, you have asked how you can help Shauna. Her family did start a GoFundMe account. You can find a link to that on our website and on our 12 News app. So to come, one potential Supreme Court case might bring change for service members as they seek justice for medical malpractice cases.